Hello, I am Glodiana Sinanaj, lecturer at the Research Center of Public Health, Faculty of Health, University Ismail Qemali, Vlora. The title of my presentation is Rheumatoid Arthritis, one of the main health problems of healthcare workers during their work. The purpose of this review study is to provide an overview of the importance of managing rheumatoid arthritis as an essential practice in the quality of life of healthcare workers. Methodology. This literature review was conducted based on a regular systematic electronic study which included publications of the last 5 years which had access to the subject in question, such as PubMed and Google Scholar. 7 studies are summarized because of similarity in income criteria. Definition of rheumatoid arthritis. Rheumatoid arthritis is an autoimmune and inflammatory disease, which means that your immune system attacks healthy cells in your body by mistake, causing inflammation, painful swelling in the affecting parts of the body. Rheumatoid arthritis mainly attacks the joints, usually many joints at once. Rheumatoid arthritis commonly affects joints in the hands, wrists, and knees. In a joint with rheumatoid arthritis, the lining of the joint becomes inflamed, causing damage to joint tissue. This tissue damage can cause long-lasting or chronic pain, unsteadiness, lack of balance, and deformity. Rheumatoid arthritis can also affect other tissues throughout the body and cause problems in organs such as the lungs, heart, and eyes. Symptoms associated with rheumatoid arthritis: swelling, pain, and stiffness in the joints in the hand, a warm feeling around the joint, deformities and contractures of the joint, weakness due to anemia caused by low red blood cell count, nodules or lumps, particularly around the elbow, foot pain, bunions, and hamartosis with long-standing disease, fever, cysts, loss of appetite, decreased energy. Characteristics that increase risk. Age. Rheumatoid arthritis can begin at any age, but the likelihood increases with age. The onset of rheumatoid arthritis is highest among adults in their 60s. Sex. New cases of rheumatoid arthritis are typically 2 to 3 times higher in women than men. Genetics. Inherited traits. People born with specific genes are more likely to develop rheumatoid arthritis. These genes, called human leukocyte antigen class II genotypes, can also make your arthritis worse. The risk of rheumatoid arthritis may be high when people with these genes are exposed to environmental factors like smoking or when a person is obese. Smoking. Multiple studies show that cigarette smoking increases a person's risk of developing rheumatoid arthritis and can make the disease worse. History of live births. Women who have never given birth may be at greater risk of developing rheumatoid arthritis. Early life exposures. Some early life exposures may increase risk of developing rheumatoid arthritis in adulthood. For example, one study found that children whose mothers smoked had double the risk of developing rheumatoid arthritis as adults. Children of lower-income parents are at increased risk of developing rheumatoid arthritis as adults. Obesity. Being obese can increase the risk of developing rheumatoid arthritis. Studies examining the role of obesity also found that the more overweight a person was, the higher his or her risk of developing rheumatoid arthritis became. The impact that rheumatoid arthritis has on the career and the professional life is potentially serious. A recent study showed that people living with rheumatoid arthritis are at least 53% less likely to work than the general population. A study in the Journal of Occupational and Environmental Medicine found that people with rheumatoid arthritis miss nearly 14 work days a year compared to fewer than 10 days in people who didn't have the condition. Those missed work days added up to nearly $252 million in lost revenues nationally. Even if you're able to work, rheumatoid arthritis symptoms can affect productivity, a phenomenon known as presenteeism. This is due to a variety of factors. Often, the pain, fatigue, and medication side effects that come along with rheumatoid arthritis can be unpredictable. Some days, a person living with rheumatoid arthritis may be able to work, exercise, and be productive. Other days, the same person may struggle with everyday tasks, lack of sleep, debilitating pain, disabling stiffness, joint swelling, or drug side effects such as nausea, headache, lightheadedness, and drowsiness. People living with rheumatoid arthritis and similar conditions may also experience other symptoms such as brain fog or cognitive sluggishness, muscle spasms, flu-like symptoms, general malaise, and discomfort. The pain and joint immobility associated with rheumatoid arthritis can also be severe. Rheumatoid arthritis statistics: up to 14 million people around the world have rheumatoid arthritis. Rheumatoid arthritis affects more than 1.36 million adults in the US. Arthritis and overall health. As many as 88% of people say arthritis affects their quality of life. 54% of survey respondents reported moderate to severe arthritis pain. 58% of survey respondents reported that arthritis has had a moderate to significant impact on their lives. 24 million US adults are limited physically by their arthritis. Arthritis is the leading cause of the disability in the United States. More than 8 million working adults face work limitations because of their arthritis or other rheumatic conditions. 2 out of every 100 mild people die from arthritis every year. People with osteoarthritis have a 24% higher risk of getting cardiovascular disease than those without it. It's estimated that by 2040, an estimated 35 million adults will report arthritis attributable activity limitations. Healthy lifestyle habits can help prevent rheumatoid arthritis, which are no smoking, moderate alcohol consumption, healthy body mass index, BMI, good physical activity, and healthy diet. The first study included in this work is a study done by Anne Metzger, realized in 2020. In methodology, this is preliminary report of a hospital-based cohort study. The study was performed in 2 stages. During the first stage, a specially designed questionnaire was conducted by trained residents with 2,569 hospital workers from 6 government hospitals to identify individuals with rheumatoid arthritis. As a conclusion, this is the first epidemiological survey among healthcare workers in Jordan. The prevalence of rheumatoid arthritis among hospital workers in the north of Jordan is 0.31% with a female predominance. Careful follow-up and monitoring of patients with rheumatoid arthritis is necessary as they are at increased risk of having multiple comorbidities. Second study is study done by Cornelissen, Le et al. This study was realized in 2021. In methodology of this study, an explorative mixed methods study was performed to investigate patients' values for health treatment decisions and their importance in order to develop a future decision aid on value qualification. At conclusions, a variety of values may guide patients' health treatment decisions within rheumatoid arthritis care. Patients and professionals should discuss patients' value continuously. The third study is the study by Vlora et al. This study was realized in 2022. In methodology, this qualitative study was performed using semi-structured, in-depth interviews with healthcare professionals. An interview guide was used based on an adjusted version of the theoretical domains framework. In conclusions, the study provided insights in healthcare professionals' perceptions of the barriers and facilitators to disease-modifying anti-rheumatic drugs used patients with rheumatic arthritis. Most factors that were mentioned were patient-related and potentially modifiable. The fourth study was studied by Glodiana et al. Was realized in 2020. In methodology, a literature review using an integrative approach to identify reporting and evidence-based challenges and good practice examples in the management of rheumatoid arthritis and its associated comorbidities. Approximately 118 qualitative semi-structured interviews were conducted to gain a robust understanding of the management of rheumatoid arthritis and associated comorbidities through the visits. In conclusions, we identified 18 models of good clinical practice which are linked to 3 different disease stages. Further work is needed to explore the ability to implement each of the interventions, such as the development of tools and manuals detailing their implementation and the results achieved. The next study was the study done by Valentina Vodovic et al. This study was realized in 2019. In methodology, we conducted a systematic literature search of peer-reviewed literature available in English and published between 2013-2018 using 3 databases like Quran, PubMed, and MBS. We analyzed the publications based on the framework on integrated people-centered health services and the quadruple aim framework. In conclusions, our findings suggest that for rheumatoid arthritis, integrated care is in the early stages of development. Strategies focusing on patient outcomes and patient satisfaction were found to be prioritized. The next study was study done by Patricia Minnock et al. This study was realized in 2016. In methodology, a systematic search was conducted from 1,000 1919 till 2016. In conclusion, criteria were patients with rheumatoid arthritis, adult population age up to 16 years, nurse as part of the care team or intervention delivery, primary research only, English language, and quantitative studies with nursing-sensitive outcomes. This review is notable in that it is the first to have identified and reported a set of multidimensional outcome measures that are sensitive to nursing interventions in rheumatology specifically. Further research is required to determine a core set of outcomes to be used in all rheumatology nursing intervention studies. Other study was Emi Matsura et al. The study was done in 2021 in methodology female rheumatoid arthritis outpatients completed anonymized self-reported questionnaires. Their confidence in self-managing different aspects of rheumatoid arthritis and satisfaction with relationship with medical professionals were assessed using a visual analog scale. Multiple regression analyses were performed to identify factors correlated with health-related quality of life. In conclusions, to improve health-related quality of life in these patients, we must establish good patient-provider relationships and personalized strategies based on physical and mental conditions, enabling normal daily living. We should help achieve functional and social remission by improving their confidence in self-managing their disease. Discussions: the estimated prevalence and disease burden of rheumatoid arthritis vary considerably between geographic regions, with generally higher estimates in industrialized countries and urban settings. Aspects involved in the disparity in rheumatoid arthritis prevalence between populations include genetic factors, environmental exposures, demographic, socioeconomics, and reporters of the disease. Despite rising rheumatoid arthritis prevalence, the severity, mortality, and disease-associated comorbidities seems to be decreasing. The etiopathogenesis of rheumatoid arthritis involves interaction between predisposing genetic factors and environmental triggers, mostly at mucosal sites like oral cavity, respiratory system, and intestinal tract, resulting in the mucosal origin hypothesis. Many rheumatologic arthritis risk factors are modifiable, including dietary habits and inhalation of populations such as tobacco smoke. Modifications are being incorporated in prevention strategies. Thank you.